Good morning and welcome to the 9th Annual Kentucky Rural Telehealth Summit. Today we have many experts in the room, many different people to talk to about how to set up telehealth, how to organize telehealth, what's worked, what may not have worked.
Health and healthcare is different at your community healthcare facility, at your hospital, at your clinic.
Nobody does telehealth by themselves, and so it's really important that we bring all healthcare facilities together and figure out how do we do this together to serve all Kentuckians.
Telehealth really enables us to expand access to care across a pretty geographically isolated area. We can have healthcare providers and specialists in one of our larger communities that's able to see and treat patients from our smaller communities through the use of telehealth technologies.
It's sort of built into, like, if we want to minimize our no-show, improve our effectiveness and efficiencies within, healthcare access and healthcare equity.
Having a day like today brings many opportunities as far as being able to collaborate with other individuals, have a lot of different collaborative conversations and talk about different opportunities for how health information is being used to ultimately provide quality care to patients in an equitable manner.
Is so important, especially in rural areas. We end up with a concentration of healthcare providers and specialists in urban areas, and in our rural communities we don't have as much access to that knowledge and those services, and telehealth is bridging that gap. It allows that expertise to go everywhere.
I think it shows that there's a lot of support for telehealth. It was nice to see the president of the American Medical Association speak on supporting telehealth.
This is the way to sort of do the research and prove the value as it relates to telehealth.
I'm Dr. Bobby Mukamala, and I'm an otolaryngologist and ear, nose, and throat doc in Flint, Michigan. But I'm here today as the president-elect of the American Medical Association to talk about the value of telehealth to the future of care in our country. We have a physician shortage in this country. We're predicting to be about 80 to 100,000 physicians short just to take care of the needs that our country has now. This next generation of physicians needs to be able to take care of patients, not in the traditional sense of having them have to leave home. This is a fantastic way to be able to maintain their ENT health.
And to hear all those stories and ideas, to be able to come up with new ways to benefit individuals that use telehealth services, and I think it will greatly impact the policies moving forward.
I think that what works best when it comes to advocating, whether that's a lawmaker, whether that's a payer, is the story, right? So the story of the kid that has a vision issue in Appalachia, in the Upper Peninsula of Michigan, that can't drive the 6 hours to get down to Southeast Michigan or metropolitan Kentucky to get that taken care of. Protecting that kid's vision is something that everybody would agree with, right? And if telehealth is the way to accomplish that, then absolutely we should preserve that as a tool.
We are really, really lucky here in this state because I think our legislator really recognized the value of telehealth really early on. So when the pandemic hit, I think we were in a really good place to still be able to provide care to our patients because we had the coverage, we had the reimbursement already, but there's still work to do.
And people are realizing how an app on your phone or how a video on your TV or your computer can supplement your treatment, can make it easier to get the care you need, particularly in behavioral health, but also in physical health. It can remind you to exercise or take your medicine or do a check-in with your provider. And we're making that much more creative, much more exciting, and to induce providers to do it and to push their patients to do it, we pay the providers. I think medicine is advancing very rapidly as a result. We're trying new things and we're paying for them, and we're all going to be healthier as a result.
Others are more permanent, but we are seeing that movement. So,
Also, our planning team at the Center of Excellence in Rural Health, of course, is my Excellence in Action team. And I thank each and every one of them for all the work that they've done. And a special call out to Wayne Noble, who is at the forefront of making sure that today is a success.
To be able to provide care for patients when they're at home is going to overall improve the health of this country.
The rules are always going to change, But what telehealth has proven over the last 4 years since the beginning of COVID is that no matter what comes at us, telehealth is part of the solution.
I hope that we learn from each other, we share from each other, and we go back to provide better health care access for the people that we serve.